Greetings. This is Sophia Asan of the Reproductive Health Supplies Coalition. We welcome you all to this webinar today, which is hosted by the Safe Abortion Supplies workstream of the Coalition's NERT caucus. A few housekeeping notes as we prepare to begin. Please do keep yourselves muted unless you are speaking to the entire group. And you can feel free to enter your questions or comments at any time in the chat box. And the presenters will answer as they are able, either in the Q&A portion at the close of the webinar or in writing prior to that. So we're pleased today to have two presentations to share with you. And in the first one, we have a session led by IPPF. In August 2022, IPPF launched an updated medical abortion commodities database. And that will be the topic for our first presentation. It will be shared by Catherine Kilfetter. Catherine is the Senior Program Advisor for IPPF's abortion program. She supports a global abortion service delivery program in 18 countries, and she has a particular interest in and focus on medical abortion. So on that note, I'll go ahead and turn it over to Catherine.
Thanks, Sophia. Hi, everyone. Can somebody confirm that my slides are showing?
Yes.
Yes. Okay. Thanks. Thanks very much. So thanks, everybody for attending this webinar today. I'm excited to give the latest installment of presentations on the medical abortion commodities database. So just before I get into the activities that we've just undertaken and the relaunch of the site, I'll just give a quick background in case you weren't around when it launched or if you've forgotten. So 4 years ago, we launched the Medical Abortion Commodities Database, which is medab.org. And it was set up to be a database to house information on the availability of misoprostol, mifepristone, and combined packages of the two drugs available at the country level. The two keywords here are quality and availability. So the database includes misoprostol that has been that meets international quality standards, and it's all defined on the website, and also the combi packs whose misoprostol is also of quality standards. And in terms of availability, the aim is to make sure we have products that are not only just registered in a country, but also available at end users. So for end users at retail outlets. The database was set up initially to really be aimed at program and policy people who are working to inform policy and use in their country programs. And that's just important to remember because I'll come back to this later in the presentation when we're talking about who's actually using the site. And also as a bit of background, just to remind everybody, this is the Safe Abortion Supplies Workstream work plan updated in December. And the database has been kind of a standing activity on our work plan for the last few years, and it continues to be so, but more in a way to improve the site and keep it updated and to continue to explore ways to improve it. So it is still meeting that purpose. And the idea was originally to get back to this group to provide input and feedback after a little pre-launch. Unfortunately, we hit a few delays and completely ran out of time. So in Safia's introduction, that just shows that I was a bit more organized in preparing the blurb for this webinar than we were in actually launching the site. It was meant to be launched in August, but that was not the case. So last year, we decided, well, we needed to redevelop the site for technical reasons. So our IT company came to us and said that the site is going to basically die unless you do these certain technical developments. And so we took that opportunity to think, okay, well, how can we actually stop and just take a minute and see who's using it and how useful people are finding it, and how we can possibly improve it. So we worked with our IT partner called Agile Collective, and they took us through the design thinking methodology to make sure that we designed a good relaunch of our site. So before we set out, we did a quick look at our users, and we saw that in 2021, we had more than 30,000 people use the site, and that was compared to 773 in 2020. So we spent quite a lot of time trying to figure out if these were real people, and we're pretty sure they were. And 96% of them were new users. So it was quite a lot of people coming to our site in 2021. So we set out on a few different activities. The first one was to just do a deep dive of our analytics, just to try to figure out who are all these people coming to our site. So we did that, and then we also interviewed a few people to find out how they used the site and how they could, how they wanted to use the site and what was missing. So our deep dive into our analytics found the most of the users, apart from the US, that most of the users are coming from low and middle income countries. You can see in this table here the 2021 top 10 countries where the users were coming from. And we looked at the language, and this is all based on just the Google Analytics. So we were looking at what language are they working in and what language is our internet set up in. Unsurprisingly, the largest percentage was in English, but there's a big chunk of our users who are using the site or accessing through Spanish language. And so this goes alongside all, if you look beyond this top 10 countries and you keep looking, there are quite a few in Latin America. And we also saw that most people were accessing on their mobile phones. This was a big shift. In 2020, it was mostly desktop. So then looking at all of this, we thought, well, how can we find out who they are? Like, are they the program managers and the procurement managers that we're trying to reach? So we put a little questionnaire, a pop-up questionnaire, one question on our site for 7 weeks at the beginning of 2022, just to say what best describes your role. Quite frankly, I wasn't really expecting very many people to respond, but we had more than 2,600 responses during that 7-week time. And this is the result. And I did share some of this in a previous webinar with this group before we started to redevelop the site. So it might be a bit repetitive. But you can see the smallest group were the sort of procurement manager, program manager, those kind of people that we thought would be using it, as well as the researchers perhaps looking to inform policy. But the majority identified as being an individual seeking information or care. So this, we had a lot of discussions about this. We're not a service providing site. We're not going to become one. There are excellent sites out there, but we couldn't ignore this information. And so I've worked with some of the partners that operate the service providing sites, and we've looked at data, and their data aligns with ours. So these top 10 countries of users coming to our site are kind of aligned with the people who are contacting some of these sites. So we took all this information and thought, okay, now how can we improve the site? So the first thing we did was we removed all the pages that nobody was going to. And then we decided to improve the homepage, which you can kind of see this is a little snapshot of the homepage on this slide. We made the homepage the landing page. Bizarrely, it used to not be. And also the landing page used to be a page that didn't even have the search on it. So we listened to the people we interviewed, and who said, "Where this is ridiculous, why isn't the search page visible?" So we've put it clearly on the home page, and this is first and foremost, it is what it says on the tin. It is a database where you can find this information about medical abortion drugs. And we also, when we rebuilt it, aimed to meet broader range of user needs based on that previous slide. And we improved the mobile user experience because it was pretty bad. We made the search easier to find, as I've said. We kept the research page. Initially, the IT guys were saying, well, you should probably lose that because it's not your key target. But we saw that such a big group of researchers and academics are using this site, and we see it referenced a lot in literature. So we thought, well, let's just keep it, and we'll hopefully be able to improve it at some point and add on to it. And finally, we improved signposting, which is how we addressed that large group of individuals looking for care. So what we've done is, down at the bottom of the page, we have 3 calls to action. And the middle one there is really just to get people who are landing on the site, probably because they're looking for some kind of information or care or pills. And we're trying to get them out of our site, which is probably not, what may not be useful to them, and get them to the sites that offer services and care online. And just a quick update. So since while all of this was going on, obviously people were continuing to use our old site. So just wanted to share with you a bit of information from the first 8 months of this year. We had more than 50,000 site users in the first 8 months. So it is just continuing to grow quite sharply. 97% of those are new users, and still most of them are on a mobile device. And in terms of the countries, it's largely the same. So the top 10 countries are the same, apart from the entry of Brazil, which came in at the beginning of the year, and throughout the years kind of been creeping its way up. And as of the end of August was number 4. So finally, on the 9th of September, we launched our site, and have been just fixing a few little bugs, but otherwise everything seems to be running okay. And we made sure we were coinciding with the FIAPAC conference in Riga, where I presented a little poster about what I've just presented here. And in terms of what's next, the main thing I think that's relevant for this group is we need help keeping it up to date. So now that we've got this nice new site, we realize a lot of the content's quite old. We try our hardest to keep it up to date, but it's quite a big task. So I just want to give a little a pitch to the community to just let me know if you notice any information's out of date, or if we're not including something that we maybe should be, and we'll follow up and get that on the site. The other thing is we're going to continue to look for funding. where our current funding is going to run out at the end of next year. So we need the basic funds just to maintain the site. But in the meantime, we're looking to do a bit more targeted work on updating the site. So that will include hopefully more in-country data collection, possibly getting some support to really try to identify what products are still relevant and which ones should be removed and which ones should be added. And we're going to still try to make sure we're meeting the user needs. We've learned that we need to keep up with who's using our site and how we can best meet people's needs within reason. So with that, I will close, and I think I will take questions at the end. In the meantime, I'm happy to comment on questions in the chat if there's anything you're wanting to ask in the meantime. Thanks very much.
Thank you so much, Catherine, for your great presentation on the database. And now we'll be moving to our second presentation. And in this session, we'll be having our presenters reporting back on key outcomes, successes, and lessons learned from activities undertaken in 2019 to 2021 in two Central Asian countries, Uzbekistan and Kyrgyzstan, to improve the availability of co-packaged mifepristone and misoprostol. We're pleased to have two presenters joining us. One is Dr. Rodika Commandant. Rodika is an obstetrician gynecologist, the director of the Reproductive Health Training Center and Regional SRHR Coalition. She's an associate professor as well at the State Medical University in Moldova. Rodika is the consultant for Women Help Women organization, the board member of the Global Doctors for Choice, and member of the FIGO Safe Abortion Committee. She's been a long-term consultant with Concept Foundation, consulting on a number of projects over the years relating to increasing access to medical abortion, and most recently, the improving availability of co-packaged mifepristone and misoprostol in selected countries project. Along with Rodika, we're pleased to have presenting for us our co-chair, one of our co-chairs for the SAS work stream, Petra Proctor. Petra is a senior program manager at Concept Foundation. She manages projects spanning Concept Foundation's three functional pillars, including research and innovation, manufacturing and development, as well as country support. Petra has been coordinating and managing projects that focus on improving access to quality, affordable SRH medicines for the past 11 years. She's currently heading Concept's ongoing activities in increasing access to medical abortion in LMICs, and she was the project manager overseeing completion of activities under the improving availability of co-packaged mifepristone and misoprostol project in its final year. And so following this presentation, our other co-chair of the SAS workstream, Natalie Kapp, will be moderating a Q&A. So please do feel free to enter any questions or comments in the chat box. And I'm pleased to turn it over to Petra and Rodika.
Thank you, Sophia. I think, Sophia, you're putting my slides up, correct? Our slides, sorry. Great. Thank you. Good morning, good afternoon, and good evening to you all. Thank you for joining today's webinar, and thank you SAS work stream and the RHSC for inviting us to present and for facilitating today's webinar. We're really excited to be finally sharing the outcomes of this project, a project Concept Foundation undertook over a period of 3 years, entitled, I think you've heard the title about 3 times now, but I'm going to repeat it once more, Improving the Availability of Co-Packaged Mifepristone and Misoprostol in Selected Countries. So with me today, I have Dr. Rodika Commandant. She's already been introduced. But she will be joining me in sharing the successes of the project in 2 countries in Central Asia, Uzbekistan and Kyrgyzstan. And I would also, before moving on to the next slide, like to share that we're also delighted to be joined by our colleagues and partners from both countries, Dr. Batikul Bozgopueva and Rakat Abdikalikova from the Kyrgyzstan Family Planning Alliance. And we also have Dr. Dilfuza Kurbanbekova, the Deputy Director of the Women's Wellness Center in Tashkent, Uzbekistan. Next slide, please. So we have divided today's presentation into 2 parts. I will start with going over the project context in terms of the current barriers that continue to prevent widespread access to medical abortion drugs in Central Asia. And I will provide an overview of the project's objectives and goals. And then Rodika will take us through the outcomes and the lessons learned in both Kyrgyzstan and Uzbekistan and conclude with some updates on where things are at in each country today. Next slide, please. So a little bit of background. I think everyone on this webinar will know these things, so I'll move it quickly. Medical or medication abortion offers an important alternative to surgical abortion for people who are wishing to terminate a pregnancy in its early stages. The procedure is non-invasive and has been a game changer in the provision of safe abortion services worldwide in both restrictive and unrestrictive settings. Indeed, decades of clinical evidence suggest that medical abortion can be safely provided without the need of clinical intervention, which has in turn opened up more options for service delivery, such as telemedicine and online services that Catherine referred to as well, websites, etc., such as Women on Web. However, the global safe abortion community continues to face challenges in improving the availability of safe and effective medical abortion medicines and providing better choices and options for individuals wishing to safely terminate a pregnancy. One key challenge that has emerged over the years is quality. Starting in the early 2000s, a number of transformative studies were undertaken that demonstrated issues of quality with misoprostol, one of the drugs used in the combined regimen, and more recently, evidence has started to emerge on issues of quality with mifepristone, the other drug used in the combined regimen. And the impact of a patient receiving a substandard or counterfeit medical abortion treatment can be potentially life-threatening. Possible outcomes including an adverse drug reaction, an incomplete abortion, or a failed abortion, which could lead either to an unwanted pregnancy or further attempts at an abortion that could then be unsafe. And all of these 3 outcomes can lead to short and long-term physical and mental impacts on the user. Furthermore, awareness of poor quality abortion drugs in the global community and the anti-abortion community further reinforces the negative perception that we see of abortion and medical abortion drugs. Thus, today, as we move into an increased provision of self-care for medical abortion, ensuring quality becomes of paramount importance. And by quality, we mean demonstrably quality assured. And in the context of this project that we're reporting back on today, at the time of starting the project, there were no quality assured medical abortion drugs in either country. Next slide, please. And another issue that goes hand in hand with access to quality is price and affordability. Today, in many settings, abortion drugs remain unaffordable for those who need them. And again, in both countries at the start of the project, and also more broadly across the Central Asian region, while abortion is available on request, it's legal, medical abortion is still not very widely used, or was not being widely used at the time. And the medical abortion drugs that were available in the public health sector were not quality assured. And there was also significant poor quality and counterfeit drugs market, black market issue as well. And as we see in other regions of the globe and in other sexual and reproductive health product markets, it is a lack of market competition that continues to impose challenges on making quality assured medical abortion drugs more widely available, and alongside this, a lack of a harmonized procurement policy environment in place at the national level, allowing products that continues to allow products to circulate and be supplied that are not quality assured. And given the long-term health and social and economic impacts of not ensuring quality, or not ensuring that users are being given access to quality assured drugs, it's a false economy really to compromise on quality. However, being realistic, to avoid supply issues and continue to ensure access to all people that need access to these drugs, we need to strike a balance between affordability and quality, and work at the country level to bring about the step-by-step changes that are needed to ensure wider access, more choice and availability of medical abortion drugs. Next slide, please. So it's in this context, well, this is the context that formed the basis of this project, and the activities of, that we conducted in Kyrgyzstan and Uzbekistan. The overall project was to increase both the availability, but also access to affordable quality assured mifepristone and misoprostol combi packs in 2 geographical areas. So not only Central Asia, the project also had activities in some countries in Southern Africa. However, today we'll be reporting back specifically on those activities conducted in Kyrgyzstan and Uzbekistan. And as already mentioned, the project ran over a period of 3 years, from April 2019 to April 2022, with some activities actually continuing into 2021, not 2022. And finally, the project was funded by the WHO Reproductive Health Research, and was conducted in collaboration with the Unsafe Abortion Unit. Next slide, please. So just some further country context. In both Kyrgyzstan and Uzbekistan, the rate of unintended pregnancy and the rate of abortions has declined over the past 3 decades, resulting from improved education, sexual education, and access to modern contraceptive methods. However, the share of unintended pregnancies ending in abortion remain high, at 79% in Kyrgyzstan and 80% in Uzbekistan. Underlying an ongoing need for access to safe, effective, affordable abortion services and medicines. And I think we have to remember that of these numbers, a proportion of abortions will be going unreported, and definitely a portion of those will likely be unsafe. Next slide, please. So finally, and keeping that broader project context in mind, and the issues we face with quality and affordability of medical abortion drugs, and applying it at the country level, we designed a series of standalone but interlinked activities to be undertaken in each country, with the objective of increasing the availability of quality assured product registered in each country, and in parallel working with the government, Ministry of Health, to update national guidelines and procedures, and to update the national public health strategy as it relates to provision of sexual and reproductive health medicines, and specifically abortion drugs where relevant, as a lot of these activities go hand in hand at the country level. We also coordinated these activities with professional organizations playing a central role in provision of abortion services and medicines. So, for example, medical institutions, national federations of midwives, pharmacists, nurses, national societies of obstetricians and gynecologists. And we also worked with them on updating national protocols and guidelines for provision of safe medical abortion. And last but not least, we worked on capacity building of healthcare providers, which I won't comment further on. I'll let Monica explain a bit more about what we did. So this was the framework and 4 key focal areas. So numbers 2 to 5 on the slide that we worked in. And in some cases, activities had to go step by step, and in others, they went on in parallel. And throughout the project, we worked really closely with Brodika, who is our central focal point in Central Asia, and also our country partners, who I introduced at the beginning of the webinar. And we really are grateful for such a great collaboration that we had amongst the team. So I will now hand over to Brodika, who will take us through what was achieved in each country, how we did it. There's a lot of information on the slides. We did that on purpose so that people accessing them later would be able to take away as much as they could. But Brodika will take us through those, and over to you, Brodika. Thank you very much.
Thank you, Petra. Thank you, Sophia, for the introduction at the beginning of the presentation. I'm very glad to continue with more concretely on the outcomes of the activities in Kyrgyzstan, and then Uzbekistan will be next. From the beginning, I would like to say thanks to one of the main partners of our work in Kyrgyzstan, Kyrgyz Family Planning Alliance, which is IPPF affiliated organization, which is a leading organization in the field of reproductive health in the country. And I would like to start by saying about our work at the level of policy changes. So it was the updating of very famous 618 order, which was outdated and was posing very serious barriers toward safe abortion in the country. And there were discrepancies between this order and the more progressive law on reproductive health. And colleagues were telling us that they have attempted to change the order in 2015, but couldn't do this. So it was like a first direction of the activity. And the working group was created, and it was revised to align it more to WHO recommendation, but also because a new protocol was developed and approved by the Ministry of Health. So there are 2 documents were completing each other and not posing barriers. So, for example, one of the main barriers was the list of requirements toward first trimester, toward second trimester. For the second trimester of medical social indications, it was a huge list of indications, like this woman was undertaking abdominal surgery. So and also the requirement to have a special permission from the commission, a huge list of members of this commission, and other barriers. So this the procedure was simplified, but also the access to medical abortion was much improved. But by allowing it up to 12 weeks at the primary level of care, the list of requirements or testing was simplified, and many other progressive things were included in these 2 documents to improve the access and the quality of abortion, including to medical abortion. By the way, I would like to mention the synergy, the collaboration between the project coordinated by Concept Foundation, Safe Abortion Action Fund project, which for example, the development of the protocol was supported by this Safe Abortion Action Fund project. Next, please. Another very interesting activity, very useful, I think, because there were more directions of the activity, which would finally came to a very nice and very balanced comprehensive program on improving access and quality of abortion services. I mean the improving or the to improve the level of knowledge and the capacity building of the abortion providers. To obtain this, we developed a tool which we call training template. Basically, we took WHO recommendations, we listed them according to the directions or the themes, and offered this template to the colleagues from, it was again an working group, comprising representatives from all medical institutions, all medical teaching institutions at all levels, to allow them to compare the curriculum existing at that time in the country, starting from the midwives, students, university curriculum, postgraduate curriculum, to compare what they're having in the curriculum to WHO recommendations, to see what's missing and to complete the modules with these recommendations. So this was done, the modules were finalized. They were approved by the Ministry of Health. You should know that in these countries, nothing can happen without Ministry of Health approval. So it was approved by the Ministry of Health, printed, disseminated in April. And I would like to show, next slide, please, how colorful they were, how nice. You see there are different modules for all medical institutions. And of course, they constituted a very good base for the training of trainers we conducted in 2021. It was again a self-sponsored project. It was training of trainers. 25 providers, academic staff were trained in this training. And the materials of the training, of course, they were these revised and printed modules, but also all the teaching staff of the academic institutions were, these modules were distributed to academic staff to serve as a base of their revised teachings. And also it was very important to, by this exercise, to unify the content of the programs. So the way that midwives, students, then young doctors, family doctors, OB-GYNs will know the same unified information, but divided by volumes. Midwives certain volume and then increasing volume until the specialist level of knowledge. Next, please. Also, a very important finding colleagues shared with us, it was that there were a very weird situation in the same level of medical institutions. There were different prices for the services. So, and also it was very interesting to understand the pathways of the procurement, how the drugs are getting to women, how women have access to the drugs. It's why another direction of the activity was the identification of optimal procurement pathways for supply of medical abortion drugs, and also unify the price for the services in the institutions, medical institutions, the same level of services. So another working group was created by Ministry of Health, and specialists of procurement from the Department of the Ministry of Health were included in these working groups. So the situation was analyzed and of these paid and free services. And this analysis was presented to the Ministry of Health in the roundtable, to the Mandatory Health Insurance Fund, Department of Drug Policy, to appoint a responsible person for this implementation. And we know from colleagues from Kyrgyzstan, they continue now to do follow-up activities of this direction of activities. So they now implement this unified price in the country to allow better access to services. And of course, the central part of this activity was in Kyrgyzstan was registration of Mendable in the country, which happened in April 2020. And it was a big joy from all of us, because at a certain moment, all the other medical abortion drugs which were available in the country needed re-registration, so they just disappeared. And only this Combipack remained the country, which is CRA approved, we know. It was also quite challenging process. For example, the first insert we have seen, which was already printed and ready for the registration, contained the phrase it should be given or administered only in the hospitals, only under supervision of OB-GYNs. So it was again another series of advocacy activities to remove these requirements from the insert, or it was another requirement to put it only in the hospitals, and the intention was to improve the access, putting the drugs in the pharmacies. So again, until we have had this final step of registration and distribution in the country, it took some time and some level of work again and engagement. Next, please. As a summary, I would like to mention the improving normative guidelines, policy change at the government healthcare provider level. And here, the updating of the country policies specific to provision of medical abortion drugs by the Ministry of Health order, by the updated protocol on medical abortion, updating and unification of training models for provision of safe abortion, the capacity building of providers, and increased availability, accessibility of quality CRA-approved drug in the country, registration of Medabone, and identification of the optimal procurement pathways to supply medical abortion drugs, and the price unification of medical abortion drugs to allow better access to quality services. Next, please. I'll continue with Uzbekistan, also a great partnership with the Center of Women's Welfare and Health, presented by Dr. Dilfuza here. In Uzbekistan, it was slightly different partnership, and I would like to mention here a great support we have had from the WHO country office from Uzbekistan and Uzbek Reproductive Health Center. So the first direction of the activities was the inclusion of mifepristone and Combipack in National Essential Medicine list, which before was containing only misoprostol and only for delivery, for cervical priming before delivery. And it was, again, a long list of quite challenging to obtain this inclusion, because the requirement from the Ministry of Health was to have first updated protocol, to have this modus operandi protocol, and then maybe they will see if they can include both mife and miso in the national drug list. So to obtain this, the national protocol on safe abortion was updated and approved by the Minister of Health in 2020, quite a long and challenging process. The same activity, because at that moment the curriculum was different, so didn't describe or didn't include the provision reflected in the updated protocol. We needed again to using the same training template. We updated the modules of all teaching institutions. The modules were finalized and disseminated in September 2021. Training of trainers was conducted in December 2021. Next, please. You see here the picture, a picture from the training from December last year. And you see here this nice sitting people and standing people. They are all chairs of the departments, OB-GYN departments. They are professors. They are PhD and directors of the institutions who participate in this TOT, which again, I will repeat, was done based on the updated modules, which were updated based on the training template developed by Concept Foundation. Next, please. And coming back to the, so after we obtained the revision of the protocols, approval from the Ministry of Health, finally, based on the letters addressed to the Ministry of Health, they accepted the inclusion of both mife and miso for abortion specifically in the national model list of the drugs. Another direction of activity was development of the national plan of action or strategic plan to improve the access, the quality of abortion services. And the first or the foundation for this activity was led in 2019 during a roundtable organized by WHO and with the participation of all stakeholders in the country, where we managed to develop a list of questions we wanted to obtain the answers. Then the working group was created to include representatives from Ministry of Health, Center of Reproductive Health, national level institution, Concept Foundation, and our national consultant, Dr. Dilfuza Kurbanbekova. This questionnaire was sent to remote areas of the country to obtain better input from the regions, from the most far away medical institutions, to be able to assess the needs, to assess their view on the situation. Then the working group compiled the feedback from all these answers into a set of final recommendations, which were provided to the Ministry of Health in 2021. And based on this, the national plan of actions were developed and included the activities mentioned by the colleagues. So also another direction was the identification of optimal procurement pathways for supply of medical abortion drugs. And the goal of this work was to identify a preferred procurement route based upon available optimal collaboration with the quality assured mife combi-pack manufacturer, UNFPA, and other organization. It was an exercise to identify procurement route that would support the availability of quality assured medical abortion drugs, to be able to enable public health facilities to procure the quality drugs. And the analysis of the existing procurement situation and proposed recommendation were submitted to the Ministry of Health in April 2021. Unfortunately, the registration of combi-pack is still pending, but we are still optimistic and hope it will be obtained soon. Next, please. Talking generally about outcomes of activities in Uzbekistan, this is the improving normative guidelines policy change. As I said, inclusion of mifepristone and misoprostol and combi-pack in national essential medicine list, updating of training models, development of country plan with key stakeholders and of the protocol, capacity building of the providers, also on increasing availability and accessibility of medical abortion drugs in the country, identification of optimal procurement pathways to support of medical abortion drugs, and steps taken toward the registration of Medabon in the country. Next, please. The challenges and lessons learned in Uzbekistan and Kyrgyzstan, both countries. It's challenging to work in these countries due to political and civil unrest in both countries, different stages, often changes of the leadership of the ministries and the departments, of the project lead. And there are periods of inflation and political economic instability. Of course, this makes it difficult to establish long outcomes impacting the affordability and accessibility of medical abortion drugs in both countries. Also, the pandemic impacted very much the planned activities in 2020, 2021. However, this idea with the development of the training template, because we couldn't travel, came to us and exactly in this moment. So it worked very well. So where possible, the activities were moved to virtual, but still we managed to finalize them. Monitoring and controlling of commitments made by the key stakeholders was critical to ensuring sustainability of outcomes. But here again, I would like to mention great partnerships we have benefited from both countries. And also, I think crucial was Ministry of Health support, especially talking about Kyrgyzstan. And I said already earlier, the support from WHO country office in Uzbekistan. Next, please. Where are we today? In Kyrgyzstan, we're very happy to mention that colleagues were so enthusiastic and dedicated. They continued the activities, again, led by KFPA and funding from Safe Abortion Action Fund. They are continuing the work on improvement of quality of safe abortion services and the provision of quality post-abortion counseling for youth, adolescents, women and medical social risk groups. They aim to establish territorial economic accessibility of safe abortion, and including medical abortion, and equipment for surgical abortion, and family medicine centers. So they aim to move abortion services to primary level of care according to WHO. They are working to increase the number of youth, adolescents, and women in the medical social risk group, and to enable them to have access to reliable information on family planning and safe abortion services. They continue to work on the unification of the prices for safe abortion services, but also to obtain free of charge permission to have more groups to whom free of charge services can be offered. And also, I'm glad to inform you about a very interesting project supported by GCC Canada, the assessment of feasibility of introducing medical abortion via telemedicine in Kyrgyzstan, Uzbekistan, and 3 more countries in Central Asia. And also the self-sponsored project on promoting the latest WHO recommendations from 2022 guideline. In Uzbekistan, just finished, I know from colleagues, a pilot study on the provision of safe abortion services using telemedicine. It was a small pilot study sponsored by Genuity Health Project, and also they are participating in the same study on assessing feasibility of introducing medical abortion via telemedicine. And also, they are also part of the Safe Abortion Action Fund sponsored project on promoting self-managed abortion or abortion via telemedicine. So you see that the work didn't stop, and we have great partnership, great colleagues who are dedicated, and they continue to improve the quality access to safe abortion services in countries. Thank you.
Monica, that was wonderful, and thank you so much for taking time to present to us. We have, and actually, Petra, if you want to put your camera on, and Catherine as well. We have a couple of questions. Let's see if we can do 2 before we run out of time. Radhika, Somia is asking, she says, it's great to hear that MA drugs are in the protocols and in the essential medicines list and procurement mechanisms and in training. Is abortion included in health benefits packages, meaning is it covered by health insurance, or do people have to pay out of pocket? You're muted, Radhika.
I'm sorry. Thank you, Salmia, for the question. Yes, the medical abortion drugs are in the protocols in both countries. And for both countries, there are dedicated or by order of the Ministry of Health decided lists of groups for people who are waived from payment, so free of charge services. And most often it's about adolescents or women from social vulnerable groups having more than 3 kids. So for some groups, it's free of charge or covered by the insurers. For some groups, they need to pay.
Petra, you talked about issues of quality with mifepristone, but you didn't really go into detail. Can you tell us, are there issues besides just counterfeit mifepristone, or are there other quality issues that are not so familiar with to this group?
So you are correct. I did not go into detail for a reason. So this is based on findings from the recent quality testing study that Concept undertook in partnership with IPPF when Catherine was heavily involved with. And we did have some findings in that study that indicated issues of quality with mifepristone. The study is currently under peer review. So I can't really talk about it in detail, but as soon as it is published, we will be making it available to this group. And I think we do plan to do a webinar specifically reporting back those results, and we will definitely deep dive as much as we can into the findings. But yeah, we were, I don't know what the right word is for this. It was in a way good to finally uncover what we thought could be some potential quality issues, but it was also obviously disappointing at the same time when the quality issues have always historically been associated with misoprostol being such a highly sort of reactive and compound to specific conditions. And to date, we've kind of all assumed mifepristone's a safer bet. So on that, yeah, it was disappointing to see those results, but they were definitely there. And they definitely, I think, for us, we feel further work is needed for sure. And I'll cap it at that for now.
Thank you. And it's a kind of a preview for everybody on the call to know that this is coming. It'll be good to hear about in detail for the people in this community to really understand. And Catherine, there was a question about what if you've seen any different traffic since the launch of the database a month ago, the relaunch. Have you?
Yeah,
Do you have
thanks.
an answer to that? Or
yeah, so it's been sort of gradually increasing, kind of just constantly, but in the 2-week period when we did the launch and we kind of made some noise and had, you know, press releases and so on, there was a surge in traffic, like a pretty obvious one, but it's kind of gone back to its normal growth now. So people are still coming, and I think the lesson there is more people come when we promote it. So yeah, thanks to those on the call. I know some of you actually helped get the word out, so that definitely helps. Thanks.
good lesson, and maybe it will help get the word out for getting more funding to update some of the contents as well. Looks like we have one raised hand, and I think I'll take it, but of course we'll just go over maybe a couple of minutes. And do you want to unmute? Back to you, Gul. Yeah.
Batiko from KFPA.
Thank you so much. Unfortunately, I can speak English. Rasad, please help me and translate. Огромная благодарность Concept Foundation, потому что для Кыргызстана мы сделали за короткий период очень большой результат, получили за очень короткий период.
Thank you for Concept Foundation for the short period of time we were able to conduct so many activities and improve the situation with safe abortion in Kyrgyzstan.
И огромное спасибо Родике, которая на самом деле поддержала нашу страну и оказывала экспертную помощь для нашей страны. Это было очень важно.
Thank you to Rodika especially because she provided guidelines and support to the whole country in general with this work.
Я просто хотела бы отметить одну проблему, которая на сегодняшний день для нашей страны очень актуально, это поставка препаратов для безопасного аборта.
We also wanted to outline one of the problems right now we have in Kyrgyzstan, that we have problems with the procurement of the drugs in Kyrgyzstan, unsafe abortions.
После регистрации Медобона у нас был поставщик Санфарма. Через Санфарму мы получили 7,5 тысяч экземпляров Медобона, и он очень быстро у нас реализовался за короткий период. И у нас сейчас такой большой перерыв, нет поставок в страну, так как у нас только один поставщик. И у меня вопрос, такая же ли ситуация сейчас в наших странах Центральной Азии, или же только в Кыргызстане?
So we had one provider by the name of the company Sun Pharma, and they procured 7,000 packages of Medabon, which was sold out in a short period of time. And we wanted to ask whether the same situation happened in Central Asian countries, or is it in Kyrgyzstan only?
И это вот первый вопрос у меня. И второе, по унификации цен, это была очень хорошая инициатива со стороны Concept Foundation. Мы ее не завершили, но сейчас в рамках проекта SAF у нас уже есть результаты, мы уже пересмотрели цены, и сейчас он находится на утверждении на уровне правительства.
And also, with the help of Concept Foundation, we started the good initiative of revising the prices for medical abortion in Kyrgyzstan, and we're still continuing this work. At this time, the prices for medical abortion for safe abortion was revised, and right now it's under the review of the Ministry of Health.
Спасибо большое.
Thank you so much.
I don't know who's best to answer that, Petra and Radhika.
I'll just quickly say thank you
You
very much.
start.
Yeah, just thank you very much for those comments and for the further information. And I will have to ask Radhika if you have any knowledge or information you can share on use and supply of combi packs in other countries.
I can only use the example of Moldova because we don't have problems with the supply. But what we do, we order much in advance, much ahead of time. So we're still having the supply, and we are putting in the next order and the next order. It's how we ensure that we have the necessary amount. We have had a little bit of shortage during the pandemic, but then it was clarified, it was corrected. And we also work with the Sun Pharma via Romanian colleagues. You know, they have a representative of Romania, Therapia. Yeah. So my advice would be to be more insistent and to place order of more packages to ensure the necessary amount you need in the country.
Thank you, Radhika.
Thank you, everybody. We've gone over just a little bit of time, but I appreciate that all of our speakers were able to stay on with us. And thank you so much for a wonderful webinar, and we really appreciate your work. So,
Thank you very much.
Bye, everybody.
Thanks. Bye.
Right. Thank you.
Everyone.
Bye.